I'd now like to pass it over to our speaker, Marlee Liberman, Picmonic's Master Nursing Scholar.
Hey guys, thank you so much, Marissa. It's so good to be here with everybody. There's a couple things I just want to ask before we get started. I want to find out a little bit more about you guys and when you are taking your NCLEX, some fears that you might have. Like, we're going to be going over a lot of information today. I just want to know what you guys are up to. Great. Okay, so is everyone familiar with Picmonic? Because I know that people are probably familiar. I don't know how many people have actually used Picmonic. Basically, what we do at Picmonic is we take all the hard to remember information in nursing school and we turn them into fun pictures and crazy characters and stories, with the point of that being to create memory anchors so that you can remember all the information that you need to know on your exams and the NCLEX very quickly, so you can recall the information extremely fast. What we are going to go over today is test taking strategies. We're going to talk about the NCLEX. We're going to talk about some ways to set yourself up for success and a couple little hacks, and then go into answering your questions at the end. So one of the things, I have about 5 tips that I wanted to go over today in preparation for the NCLEX. And the first tip I want to talk about is starting early. So starting your NCLEX exam preparation early, and you can start this as early as like day 1 of nursing school, and like, don't feel bad if you haven't been doing that, if you're taking your exam now and kind of stressing about like, where do I start? What do I do? It's just the earliest to start is ideal. And if you're at the point where you're just starting now, that's also great too. Like, it's no pressure or stress. Like, I know the NCLEX feels like a giant monster and it's really scary, and it doesn't have to be. That's the thing, is that we sometimes make a big mountain out of this thing, when if you break it down and you have these strategies to control the stress and get your studying done efficiently and effectively, it's not a scary thing. I promise you that. I've been through it. I've helped a lot of people through it. It's just about setting yourself up for success. And you're going to hear me talk about that a lot. It's just about setting yourself up for success. So by doing that, like, to set yourself up for success, you want to build a study plan. So we can break that down. What does that mean? So the thing with a study plan is organization and routine is key. That is key. And if you're thinking like, oh my God, I'm not an organized person, do not worry. You can always become an organized person. And it's just small little steps about creating, I like to call it lifestyle design, because it's creating foundations in your life to support your studying habit. So if you can see here, organization and routine is key. Basically, you set yourself up for success and then you create a routine out of it. So it's like solidifying that organization so it becomes so habitual, like brushing your teeth or any other routine that you can create for yourself. You want to become you want it to become so second nature. So the lifestyle design I was talking about earlier is basically going into layers. So you want to create a schedule. And for me, the best thing that worked is using a planner or a calendar and time blocking. So with a planner or calendar, for me, it always was helpful to use like my phone, like a digital planner, just because I always have my phone on me. And so I can set up alerts and alarms that are constantly notifying me. But if you're more of a person that likes to write things out, just make sure your planner's with you at all times, and time block, and really become, while you're studying, obsessive about time blocking. It helps so much. And I'm talking about like going down to like the nitty gritty details of like coffee with a friend, 30 minutes, like workout 1 hour, call my mom, 30 minutes. Like, these things are going to help you become organized and be able to give you the foundations to be able to be really efficient with your time when it comes to studying. Because let's face it, most of us don't have time in general, and having to devote a large amount of time to studying when you have a life that you are also wanting to continue to maintain with like that being social, with that being working, if you have a family that you need to be taking care of, like it's really important that with your study time, you're also able to live a normal life. So feel bad a lot of times with like organizing your day. If you don't have a solid base of organization, you can kind of, I mean, this used to happen to me before I became super organized. It was like if I'd go out for coffee with a friend and then it would like kind of go over into like a 2-hour thing, and then instead of even being present with my friend, I was just feeling guilty that I was not studying. So I wasn't studying and I also wasn't being present. So if you time block and you say, okay, I have 30 minutes with my friend to have coffee, you're going to be present for that time, and then you're going to move on with your day. So time blocking, key. Now, moving on to the week plan. So I also like to make sure that when I was studying, that you have something that I like to call maintenance mode. Basically, you don't want to get to the end of your week being like, oh my gosh, I didn't get this and this and this done, and now I'm overwhelmed, and now I'm like spiraling. It's like you want to be at a constant flow state during the week. So a friend of mine taught me how to do this, and like use your own little weird things that you like. But like I would do like self-care Sundays, finance Fridays, you know, so like I knew on Sundays I would be doing all my laundry, and I would maybe be doing like a face mask or something, you know, like I would have designated days to do that. And that way I knew like I don't have to worry about laundry until Sunday. I don't have to worry about my finances until Friday, and they wouldn't like creep in at random times during the week and cause me to become overwhelmed. So what I would suggest is getting your planner, and then at the start of the week, whether that's a Sunday or a Monday, whatever works for you, I would create a rough draft of the week. And so basically you look at your week on your planner and you're like, your priorities, your ABC priorities. So priority A's would be like something like work, school, things that are like non-negotiables. And you fill that out during the week. Priority B's are like appointments, things that are kind of more sporadic, but like that will be coming up. And then priority C's are things that you can shift around, like coffee with a friend, going for a walk with your mom, like things that are not as essential as A or B. And then from there, going into the daily plan and really, really simplifying. And what I mean by this is not having a day plan that you're writing out like the 17 things that you need to get done today, knowing in the back of your head that you're only going to be able to accomplish 3 of those things. Because what that does psychologically is it kind of sets you up for a failure mentality. If you come to the end of the day and you look at your list of the things that you needed to do that day and you only accomplished 3 out of the 17 that you told yourself you were going to do, there's a subconscious thing that happens that tells yourself like, oh, I failed. And that's not what we want when we're prepping for a huge exam. That we want to go in with like a very big success positive attitude. So if you simplify to your top 3 attainable priorities, even if that means it's like work, studying, and like folding my laundry, and you got those done, like you were going to end the day feeling like I was successful. Okay, so we'll continue. Okay. So other study time foundations, and don't worry, we'll go into like that. I just think these are foundations that are really essential to set yourself up for when you're going into studying, because without these foundations, it's harder to build on successful study habits. So it's just something we need to cover just so you can kind of get your head into building a study plan for yourself. Other study time foundations, you want to remember, we're talking about efficiency and effectiveness. And you know, a lot of people go into studying thinking they need to sit and have their head in a book 8 hours a day. That's not effective. That's not efficient. You don't need to be studying nonstop all day. And also your brain can't handle that. Like you're just going to burn out very quickly. So ideally, we want to cut out the fluff in our day. I call it fluff, where it's like these things that are inefficient or ineffective, so you can really become like a hyper studier in a short amount of time. So what I mean by that, like saving time, is like getting rid of the fluff. That time that you're like sitting on the phone and like scrolling, that is some fluff time. We want to cut that out. So, but you know, we know that that's going to happen. Let's just like not kid ourselves. We are going to need that kind of like time to shut off and just scroll or watch TV or whatever it is. So put that in your calendar. So block off 30 minutes a day and say, I'm going to just like zone out. This is my time to zone out. I'm going to scroll. I'm going to do whatever I need to do to just zone out. And then when that 30 minutes is up, like you're done. And you can have, there's some like software, time management software that you can even like, if you have iOS or Android or whatever, Instagram or Facebook, that you can have like time limits and like follow those time limits, set time limits out for yourself saying like, I only have 30 minutes to do this. And then it will alert you that you've spent enough time on Instagram today. And then you're like, okay, there was my Instagram time. So use those. Like you want to cut out the fluff. You want to cut out the fluff of like, if you set your alarm for 8 o'clock in the morning and then you snooze for 25 minutes, that's fluff, cut it out. You know, like these are things, like I know they seem like little things, but they end up saving you a lot of time in the long run. And like you need your time when it comes to studying. The other thing is about multitasking. So what I mean by multitasking is not actually studying and doing something else at the same time. I mean, like if you want to, let's say, catch up with your mom and you also need to get some exercise in because that's a foundation to successful studying, is like calling your mom while you're walking or go for a walk with your mom. Spend quality time with your mom while you're walking, bam, you know. These are things that like you still want to have a life while you are studying for the NCLEX because it's important. You don't need to completely turn into a zombie in this process. All right, moving on. Other study time foundations, self-care is so important. So the 4 things that I think are really essential in your foundations are meditation, exercise, nutrition, and sleep. Like these are things that you also need to be very aware of that are going to help you. So with meditation, even if you're not really, if you've never meditated in your life, even if it's something that is so foreign to you, it's something like 5 minutes a day. Just go inward, close your eyes, practice breathing. You can go on YouTube. There's a lot of apps out that will help you, but this is going to help you with your focus. It's going to help you if you have test taking anxiety, which we'll touch on a little bit later, like that, like it's wildly amazing for that. So take some time, put it in your calendar 5 minutes before you start your day, just meditate. I find it really, really helps. Exercise 30 minutes a day. It doesn't have to be something crazy intense. Go for a 30-minute walk. Just make sure your blood is moving, you know, or your heart is pumping, and it's going to give you a lot of those endorphins. It's going to give you some clarity and the ability to, especially if you're sitting and working or studying, like you need to get moving. Sleep for sure, 7 to 8 hours. I don't need to, I mean, we can talk about sleep all day, but everybody knows like how beneficial sleep is, especially when you're studying, especially when you're trying to create long-term memories and solidify information. Really make sleep a priority. That is like getting that extra 2 hours of studying instead of sleeping. That's not going to help you in any way. Sleeping is really, really important. And then nutrition, make sure that you are like fueling your brain and not eating stuff that's going to make you feel disgusting or, you know, sugar crashes, any of that stuff. Like it's really important you're taking care of yourself through this process. Any questions on that so far? Okay. So moving on to tip number 3, learn actively. So you want to build what you're learning in combination with preparing for the NCLEX. You want to go into this feeling really confident. So has everybody heard of spaced repetition? And we'll talk a little bit more about that later. Let's move on to Qbanks. So you are training for a marathon, essentially. You want to act like that. And so that is like, as you would train for a marathon, going for short runs, and training for the big event, you want to do the same thing with the NCLEX. So practice, practice, practice with those NCLEX style questions using TrueLearn. So you have your question bank and you would be constantly going and practicing those. So we'll definitely talk a little bit more about that later, but I just want to mention to you, you're going to be seeing different kinds of questions. They're going to be confusing until it's like learning a new language, what the questions are kind of asking you to do. So you'll see a lot of questions that are like, what would the nurse do first? So, and this is just a general statement, so it's not going to be applicable every single time, but when you see these, what would the nurse do first, or what do you do first kind of questions, think systematically. When answering a what is the best, so you'll see questions that are like, what is the best choice, or what is the best option? Think which is the one thing the nurse can do for the best outcome and leave. And when answering a select all that apply question, read the question, read the answers, and then read the question again. It is so important that you're reading over and over again what the question is asking you, because a lot of times you'll know the content, but you just misread the question. So it's really important to read the question, take a breath, look at it, ask yourself what it's asking you. Sorry about that TrueLearn data, 500 questions for you. That remember, this is an old presentation, so ignore that for now. Going back to study time organization, it's really important in this process that you start to really know yourself and be honest with yourself. Honesty is key with this. So going into like time, like if it's like you're a morning person and you're trying to study at night and you're not going to be absorbing information, don't try to study at night. Like really know yourself, know what times you're most productive. And if you need to experiment to find out, like if you need to take a week and say, okay, this week I'm going to take all mornings and see if I am more productive in the mornings. I'm going to try in midday. I'm going to try at night. Experiment and find those times. Generally, there is like a 4-hour period of time that you're going to be most productive. So really use that time, whatever it is for you. Know the locations that you're most productive in. So if you're not going to be productive in a coffee shop because you're staring at everybody, or it's loud and chaotic, but you are thinking you are, just like really be honest with yourself. If you're a library studier, just like find that location and maximize that. And then again, back to routine. Make sure you're making this a routine, that it becomes a habit. And a lot of times this helps with a lot of people, accountability buddies. So if there's someone in nursing school, one of your friends that you can study together, even if it means just sitting next to each other and not actually talking, but just like you're kind of making a commitment to yourself, you're making a commitment to somebody else that you're going to show up. So use that if that's something that is available to you. Okay, now going into practice questions. This is very general, and this is very, every person's going to be different. So don't take this as like, she said do 100 questions per day and it doesn't work for me, but she said to do it. It's very much where you're at in your knowledge of the content, and also how you're doing already on your study progress. So in general, as just like a very easy template to use, I would say if you're going on like a 4 to 6 week study schedule, I would do about 70 to 100 questions per day. Hold on, I'm just gonna check in with everyone too, because like when I can't see you guys, I get nervous that I can't hear you. Can't hear me. Hold on. Okay, we're just gonna stay here for right now while I explain this, and then we'll go back into the presentation. So basically, what I mean by that is 100, let's say 100 questions per day. I don't mean in one sitting. That would be exhausting and you'll burn out really fast. Remember, you're training for a marathon. So in your study schedule, in your planner that you are time blocking, I would space it out into like 20 questions in a sitting. So in the morning when you're having a cup of coffee, you do 20 questions. Midday, you do 20 questions. After lunch, you do 20 questions. Right before bed, you do 20 questions, or whatever number of questions you're going to do. Just make sure, again, you make it a routine and you are making it a habit, and you're training your brain to get used to these questions as you repeatedly do them in these like amounts of times, in these time blocks. Another tip is schedule your exam and don't push it off. You're just going to become more and more anxious if you keep pushing the exam off. The information is going to become less fresh in your mind. So schedule the exam and stick to that date if it's possible. Of course, things come up things are going to change, but like try to stick to that date. So another tip is don't draw from past clinical or work experience. A lot of times people kind of get stuck in this this idea that like the question is kind of trying to trick them, and then this one time when they were working in a clinic, or when they were in clinical, or like there was a specific situation that isn't like a general thing that would happen, they can cloud your judgment. So just don't add anything to the question. The NCLEX is going to give you a scenario and leave little to the imagination. And having these things like going back to your first semester in nursing school, talking about ADPI, talking about Maslow's hierarchy of needs, these are really, really going to help you when answering a lot of these priority nursing questions. So let's go into a little bit of what I'm talking about there. The nursing process. So everybody remembers ADPI, right? Assessment, diagnosis, planning, implementation, and evaluation. You may be asking yourself, like, it's simple. I remember this from like way back when. Why is this going to help me? Like I said, a large majority of the questions are asking you to identify a part of the nursing process. So assessment are things that are the first step in the nursing process that you're going to be doing. So remember, vitals, observations, health history, reports from patients. These are things that you're basically playing a detective. You're trying to figure out what's going on. And that is a lot of times things that you're going to be seeing on the NCLEX are things that are asking you, like, what would the nurse do first? And you're always going to say, like, okay, has an assessment been done? So things, and remember, this is very general. It's not a be all end all thing, but like sometimes little clues to tip you off to think, oh, they're asking me an assessment question, are words like assess, collect, determine, gather, first, identify, observe, obtain information, recognize, do first. These are all clues that they might be asking you an assessment type question to do an assessment. Notice that and you see that there's an assessment answer option and there's like an intervention answer option. It's probably not going to be the intervention one. You know what I'm saying? Because they're asking you to do an assessment. So keep that in mind. Then you have your diagnosis and your planning. Then you have the implementation. And these are the actions or interventions that you're going to be doing. So again, if they're asking you an intervention type question, you're going to see intervention type answer options and want to do those. So little keywords that might trigger you to think that they're asking you an intervention type question are things like action, next, implement, intervene, or interventions. Those are things that you're like, huh, I think they're going to be looking for an intervention type answer option. Then with evaluation, we're looking at keywords like evaluation or evaluate, interpretation, which statement indicates ... You'll be seeing these and thinking they might be asking for an evaluation answer option. Remember, especially with the select all that apply, and generally any question, read the question, read the entire question, take a breath, ask yourself which part of the nursing process is this question asking me, if it is a nursing process type question. We do, going back into Picmonic, we have our ADPI Picmonic, we have prioritization Picmonics that will help you determine what are these questions asking me. Will all of this info be sent to us as well? I don't know if this presentation will, like the slides, but I think this is going to be recorded, isn't it?
Yeah, absolutely. We'll be able to send out the whole recording, so you can go back and take a look at all this information whenever you want.
Cool. Okay, moving on. Maslow's. Okay, so you guys remember Maslow's, right? Hierarchy of needs. It's basically you're going to be using Maslow's when you are trying to decide which patient do you see first. So that's going to be helping you prioritize. And basically, Here's our Maslow's hierarchy of needs Picmonic, you can see here. But you're asking yourself, who will deteriorate the fastest? And that's who I need to see first. That's like a big helpful hint when taking the NCLEX and they're asking you prioritization questions. Ask yourself, who is going to deteriorate the fastest? And you will be triggered by these keywords or other keywords similar to this. First, highest priority, immediate, initial, most, or vital. Those are going to tip you off to be like, okay, it's a priority question. How am I going to answer this? And then with that, when you're thinking about who's going to be deteriorating the fastest, think airway, breathing, circulation, your ABCs. Airway, breathing, circulation. Always, always, always think about your ABCs. And again, this is what I was talking about. This is one of our Picmonics on how to use prioritization in exam questions. Little helpful hints there. Okay, this is what we're going to go into some questions on TrueLearn, but like this is one that I wanted to talk about when I was talking about one of those keywords is here. It's a busy day at the hospital and the nurse just got the patient assignments for the day. Which of the following patients should the nurse assess first? Patient with a total knee replacement 2 days post-op complaining of a headache, a patient who requires a complex dressing change, an asthmatic patient with difficulty breathing, or an irritated patient who is anxious and ready for discharge. So look at the question. Remember, we want to reread the entire question again. It's a busy day at the hospital. I don't care about that information. The nurse just got the patient assignments for the day. Which of the following patients should the nurse assess first? Now remember, I'm looking at the nurse assess first, right? Assess first, meaning it's an assessment question, meaning I'm looking at prioritization, who is going to be needing me, who is going to deteriorate the fastest. Oh, I already gave you the answer. Oh, most of you guys already answered it. Okay, so actually, no, not 3. You would think, right? An irritated patient who's anxious and ready for discharge here. I'm assuming you're thinking here, like, get them out of the way so that like they're done, they're annoying me, like they're just like wanting to go home. I get that, but are they going to deteriorate the fastest? No. Remember your ABCs, an asthmatic patient with difficulty breathing, right? ABCs, airway, breathing, circulation. So assess first. The patient who is going to deteriorate the fastest is the asthmatic patient with difficulty breathing. Did they change? Oh my gosh, is that why? Okay, so you guys were right. You were right. The order changed. That was the presentation. That was my mistake. But so basically, you guys got it right. Yeah. Sorry about that. The asthmatic patient with difficulty breathing is the one that we want to see first. So the patient who's ready for discharge, they can wait. Unfortunately, like we know they want to go home and we want to be compassionate to that, but like there's not anything there that's serious for them. Yeah, number 3 was initially the right answer. Sorry about that. That was my fault. And then a patient with total knee replacement 2 days post-op complaining of a headache. There's nothing there that indicates it's anything more than a headache, right? We definitely want to see them, but not before the asthmatic patient. Same with the complex dressing change. There's nothing there indicating any sort of infection or sepsis or anything. So don't add anything to the question like I was talking about earlier. Exactly. Okay, so moving on. Sorry about that little mishap. You guys all got it right. Let's talk about a little bit of anxiety before we go into the TrueLearn platform. Does anybody have test taking anxiety? Anybody struggle with that? Because I definitely did. I know a lot of people do, especially with the NCLEX when it comes to like this pressure that this is the test, you know. Little tricks to help you with this, a lot of people do, is to, again, go back to if you are starting a meditation practice or if you have a meditation practice, it's really going to help you focus and practice your breathing. Breathing exercises really, really help. Breathing in through your nose, holding it in your belly, so deep belly breaths, holding it for 4 seconds, exhaling for 4 seconds, holding for 4 seconds, big inhale. You can try it right now. Big inhale through your nose, feel your belly expand. Hold for 4 seconds. Exhale for 4 seconds. Hold for 4 seconds. Do you see, if you did that with me, you'll start to notice a calmness that comes in to your body. It really, really slows down everything. You stabilize the nervous system. Like these deep breaths, I know it seems so simple because it's just breathing, but it is just that deep belly breaths, focusing. Those are really, really going to help you on the day of the exam and just in general in life if you can start doing that. Okay, no studying the day of the exam. I don't really feel like that's 100% accurate. I definitely recommend not heavy studying the day of the exam or the day before the exam because you're going to know what you need to know. But I would just look over brief notes. Like it's not like a hard and fast, like no studying. A lot of people recommend that, but like I think it's definitely important to lay off the day before the exam and the day of the exam. Like just go into it being really, really calm. You know what you need to know at that point. Before the exam, take a 5-minute walk just to, again, get your heart pumping, get yourself like in the state of, I'm going to be sitting here and doing questions and I just need to clear my head. There are some studies that say chewing gum during your exam will boost alertness. If it's like a mint flavor or a cinnamon flavor, it helps you kind of stimulate some thoughts. So that can help you as well. Just remember that I'm sure, I think you are allowed to chew gum during the exam. When I took it, I don't know if rules have changed about the gum chewing, but maybe not. So don't hold me to that one. I just find that like if you start to get anxious during the exam, like really, one trick that helped me a lot was like if I started to get anxious, this would happen during like nursing exams. If I saw other people getting up and leaving because they were done and I wasn't done yet, you know, I started to like go like start spiraling, and I would just have to like close my eyes, take those breaths, and like wiggle my toes. I know that sounds silly, but like I wiggled my toe. You like toes, you're all of a sudden like brought from out there back into your body, and like you're present again. So try that, helps me. Okay, so Christina says not. Okay, so maybe chew gum before you walk into the exam and then spit it out. So yeah, just chew gum as you're like walking in the door and then like spit it out before you get in. For to expect and reducing stress the day of. So map out the ride to the NCLEX testing center. The night before, lay out your clothes and your documents that you're going to need and arrive early. So basically anything that can go wrong, like do some preventative measures, set yourself up for success that you won't be dealing with anything the day of that's gonna like knock you off your game, you know? I'm a night person. Do you recommend sorry, I'm just going to jump in the cushion. I'm a night person. Do you recommend taking exam late in the afternoon? Yeah, and that's one of these things like I was talking about earlier, like know yourself. So if you know that you're really productive at night versus in the morning, cater to that. So if you can take the exam late in the afternoon, absolutely. That's like a very good clue to yourself. Like that's like trusting your gut and trusting yourself and knowing yourself and being honest with yourself. So I definitely think that's a great idea. So, okay, let's move into the TrueLearn platform. It's really cool because it is super customizable to you. And you can see it here, right? So let's say, I love this, is like you have 45 days till your test. You're going to put your exam date in there, save, and then you're going to have like this little countdown, which is super helpful. And then with all of these things too, you can customize everything here. Like what's your goal? Your goal, let's say, is something that you can customize this to what you want. 70% at this moment, I'm 26, so it looks like I have a lot of improvement I need to be doing. Overall percent correct of my exams, where the national average is. It's just like nice data to keep in mind here to have your analytics. I love this, that you can go into your incorrect topics, like all of the things that I got incorrect, I can see here, and I can see the Picmonics associated with them. I can see my past tests that I've had. I can go into those and review them. I can see graphs and analytics, like I said. to where I am, my status currently. And then when I go into creating a new test, it's also really customizable. So I can go into a time test. Let's say I'm trying to do a simulation of like the actual NCLEX. I can do it timed, I can do untimed, or I can do tutor mode, which I really like. Now, I don't know if I mentioned this, but it's really, really important that you are reading your rationales, your explanations, both for when you got them right and when you got them wrong. You want to understand what your thought process was when answering these questions, and you want to really absorb the information as like, why did I get this wrong? What am I going to do to change it next time, right? So that's what tutor mode helps you. And you can narrow this down into subjects and systems. You can see the subjects and systems here, which is really, really awesome. Really know your areas that are difficult for you and what you need to be working on. It's really important that you need to like be focusing on the areas that you need to be working on. Yes, definitely still work on the areas that you feel a little more solid in, but focus on the areas that you're like, okay, I need to be working on this and I need to feel confident with this. Reading into the question, yeah, I know, definitely it's something that a lot of us do, and I think it's hard not to do that, but like you really have to take the questions and say, this is the information I'm being presented with, and like stick to that. Anyways, going back into this, you can customize how many questions you want for each test. You can name your tests. You can search questions that had come up in the past, and if you're like, oh, what was that one question? I can't remember. You can look and see. Like I can do here, let me just show you. Like, oh, there was some question that I had, and I can't remember exactly the question, but I know it had something to do with chronic kidney disease. And let's see. Oh, look at that. They come up, and I can check and see which ones, and I can view those. So that's a really cool feature. All right, now I want to do a couple questions with you guys and show you how this would look on your own. So let's do tutor mode. I'm gonna do all subjects and systems, and I'm gonna just do some used ones that I've done earlier, and I'm going to go and do the marked ones because I marked some for you guys. So if you mark them, you have the option of going back and going into those marked questions. Then we're gonna start the test. Sorry, guys. Okay. So here's an example. A new nurse is giving a presentation on hepatitis to a group of nurses. Which statement by the new nurse requires the nurse manager to intervene? Select all that apply. Now, here's a select all that apply. Remember not to get stressed out with the just because you see that. Select all that apply. Calm yourself down. Look at the question. Ask yourself what it's asking you, and then go over the answer options. So let's just do a quick little poll, or you can just write it. If we're not going to do a poll, we can do just what you guys think the answer options are. I'll give you a second. Any guesses? Two, 3, and 5. I'm gonna just wait for some more guesses before I reveal the final answer. Cool. You guys voted. So we had 2 votes for 1, 3, the 1 and 3. Looks like 2, 3, and 5, 2, 5, 1, 2, 5, 1 and 5. It looks like the majority was like 2 and 5. I know this is a hard one to start off with a poll because it's multiple, so it's hard to see. But okay, 2 and 5 seem to be the majority. So let's go into it. I'm going to go with 2. I'm going to go with 5. And remember, because this is tutor mode, I can see the explanation right away. It's going to ask me to show the answer, or always show this for this session. Sure. Okay, so it's incorrect. Let's look at why. So we're going to see a couple of things. We're going to see 5.3 of the users answered correctly, percent of the users answered correctly. We're going to see correct answer number 1. Remember, hepatitis A requires a long-term medication regimen. And it's going to give you why. It's going to give you a whole little blurb about this disease disorder, whatever the question is. We're going to see here that we have a lot of information on the differences between Hep A, B, C, D, and E in a nice chart. It's going to tell us why answer 2, answer 3, answer 4, answer 5, and then the bottom line, okay? And then we're going to see that a lot of these questions have Picmonics associated with them. So if it's something right or wrong, I can go right into the hepatitis A Picmonic, and I can learn about hepatitis in a little bit more details about the disease or disorder right from here. If you'll be familiar with this, if not, what you'll see as you heard. But basically, you're going to see a fact list on the left-hand side with Picmonic, where it's labeled facts that you need to know about this disease, disorder, condition, or medication, whatever it is. You're going to be able to click on the fact list and understand a little bit more about those facts. And then each fact corresponds with a character in the main image. So picornavirus is represented as representation, and it's going to tell you a little bit about it. Every fact is going to have a character in the main image, and the main image is going to be a storyline. And then you can play the educational. All right, I'm just going to stop it there. But basically, it'll go through on the academic information, and then you'll go into the story. So it's going to give you a whole story tying all of these characters together. And then in order to make sure that you remember those images, you're going to start a quiz, which is a basic fact recall quiz. So it's not an NCLEX style question. It's basically asking you to recall the characters so that those characters are solidified in your memory as memory anchors. So that's how that would look. Let's do a couple more just so that you guys can become familiar with the platform. Moving on. A nurse is performing a health history on a 4-year-old child. Which immunization will the nurse anticipate administering to the child? Number 1, human papillomavirus. Number 2, measles, mumps, and rubella. Number 3, rotavirus. Number 4, pneumococcal conjugate. Any guesses here? We got a lot of 2s. I'm going to go with 2. Looks like, yeah, the poll is most people are voting for 2. Let's see if you're right. Oh, and here's another cool thing too. Like, let's say you have select all that apply or something, and you're trying to like go through and highlight. You can highlight what makes something that you're like, oh, I think that's right. You can cross them out. So these are just things that can help you while you're answering questions. But let's go with 2. Show explanation. Yay, correct. Awesome. And remember, you want to go and read the explanation. So you're going to understand why. You're going to see a chart here of all the different immunizations. And then when you scroll down, let's see if there's a Picmonic associated with it. There is. You can go right into that Picmonic. It's in place. Our internet alerts. Yep, cool. Little memory. So it would be going through that. Each video is about 2 to 3 to 4 minutes. And then you're just going to get those memory anchors in place. All right, let's do one more. I think we have time for one more. Oh, wow, I'm running out of time. Okay, let's do one more, and then we'll do some questions. The nurse is teaching a caregiver of a 6-year-old client with ADHD. Which teaching best encourages home management of the client's condition? Number 1, coordinate with teachers to facilitate academic success. Number 2, create and adhere to a routine and predictable schedule. Number 3, emphasize sleep patterns to counteract stimulant drug effect. And number 4, encourage adherence to cognitive behavioral therapy appointments. What do you guys think? Number 2, looks like it's the number 2 majority. Let's try it. Show, yes, correct. You'll get the explanation there. You're going to see clinical features, treatment, key nursing care, and then the Picmonic here just to supplement us. Let's just look at the picture and we'll go through it. And then let's go into some questions that you guys may have. So here's the Picmonic. It's a fun little one. All right, so let's go into Q&A because I know I am holding you guys for a long time.
Awesome. Yeah, thank you so
You
much.
guys want to talk about them?
We had a couple of questions that came through in the question pane. I also want to try to get to some that came through the form. I know we had so many, and thank you guys so much for pushing those through. Really quickly, just in your opinion, how far advanced do you think you should study? And when's the best time to study before you get ready to take the NCLEX?
So I always feel like the whole idea is to calm yourself down through this process. So if it's like you give yourself more time to study, you're going to feel more calm throughout. So the earlier, the better. I would say probably 6 weeks would be ideal. If you have to do it to 4 weeks, that's okay too. But I would give yourself more time so that you don't have to like really, really feel under pressure, and that you can be really calm. So ideally, like, I mean, you can start studying from whenever you want while you're in nursing school, but like when it becomes like you're graduating and you're getting ready, give yourself at least 6 weeks. 4, you can do it, but like I would say 6. Again, that's general. It depends on like how much content you already feel comfortable with. It depends on just you as an individual, know yourself, but that's like a good rule of thumb.
Someone want to know, are the select all that apply questions no longer at least 2 answers? Can it only be 1 answer now?
I'm not 100% sure on that. I don't want to like say something that is incorrect. We can look into it, but I think it could possibly be only 1 answer. Again, I'm not going to say 100% on that, but yeah.
So what do you suggest for a person who has been out of school for 12 plus years and is struggling to pass the test? Should she increase her resources, switch up her study routine?
Can you say the last part again? I think I lost it. Out of school for 12 years and you're looking to pass your exam?
Yeah, so struggling to pass the test.
I see, okay. I think it is probably looking at the foundations. Like go back to your foundations and ask yourself, like, are you setting yourself up for success? I mean, I have to understand more of like where you're not feeling confident, like why you think that you're struggling to pass, but go back to your foundations. Also look at the way you're studying. If you are more of a visual learner and you need more, like, let's say YouTube videos or lectures, or if that's how you absorb information more, versus maybe you've been just going through textbooks and reading and that hasn't been efficient for you because maybe that's not the type of learner you are, I would maybe try to understand what your best method of learning is and try to get resources that accommodate to that. And then again, like going back, making sure you're setting yourself up with an efficient study schedule, that you're not burning out or not studying enough. You know, there's different things to look at there, but try really understanding your process.
So what percentage of correct answers on the practice exam do you suggest we aim for to ensure success on the NCLEX exam?
You want to go as high as possible. I think when I looked it up recently, it also depends on which question banks you're using. With TrueLearn, I think it's, you want to go into, I think it's something like 75. Again, don't quote me on that, but you can look that up. Like, we can Google that and see. Okay. Well, remember, you guys can always reach out to us if there is any other questions that you have later on. We will be sending out a recording, and yeah, I guess just like I'm gonna leave you with the fact that like it just doesn't have to be stressful. It can be really calm. It can be a calm process, and you just have to set yourself up for success, and build those foundations, and you're gonna do great. It's gonna be okay.